8. Gastroparesis symptoms. Supplements for gastroparesis. Gastroparesis is a medical condition that affects the normal movement and function of the stomach muscles, leading to delayed emptying of the stomach contents into the small intestine. This can result in a range of symptoms, which may vary in severity among individuals. Common symptoms of gastroparesis include 1. Nausea, persistent or recurrent feelings of nausea, often accompanied by the sensation of an upset stomach. 2. Vomiting, frequent or chronic vomiting, which can sometimes be severe. 3. Abdominal discomfort. This can manifest as pain, bloating, or a feeling of fullness in the upper abdomen, especially after eating. 4. Early satiety, feeling full after eating only a small amount of food, which can lead to reduced food intake. 5. Heartburn or gastroesophageal reflux disease, GERD, stomach contents may back up into the esophagus, causing heartburn and regurgitation. 6. Weight loss, due to reduced food intake and impaired digestion. 7. Lack of appetite, a decreased desire to eat, which can contribute to weight loss. 8. Fluctuations in blood sugar levels. Gastroparesis can make it challenging to control blood sugar levels in individuals with diabetes because food is not digested and absorbed as expected. 9. Malnutrition. Over time, gastroparesis can lead to malnutrition and deficiencies in essential nutrients. 10. Unpredictable blood glucose levels. In diabetics, the erratic release of food into the small intestine can make it difficult to predict when blood sugar will rise after eating. Before we move on, would you please help us out? If you like this type of content, please hit the like button, subscribe to our channel, and turn on notifications. It really helps us on YouTube and helps others see our content. Also check out the description section below for special information to help you in your health journey. How is gastroparesis diagnosed? Diagnosing gastroparesis typically involves a combination of medical history assessment, physical examination, and various diagnostic tests. Here are some of the common steps in the diagnostic process. 1. Medical history and symptoms assessment. Your healthcare provider will begin by taking a detailed medical history and asking about your symptoms, including any digestive issues, nausea, vomiting, abdominal pain, and changes in eating habits. Be prepared to provide information about your medical history, current medications, and any existing conditions, such as diabetes. 2. Physical examination. A physical examination may be conducted to check for signs of abdominal tenderness, distension, or other physical findings that may be associated with gastroparesis. 3. Blood tests. Blood tests can be performed to check for elevated blood sugar levels, anemia, and nutritional deficiencies. These tests can help identify any underlying conditions, such as diabetes or malnutrition. 4. Gastric emptying study. The gold standard test for diagnosing gastroparesis is a gastric emptying study, also known as a scintigraphy or gastric emptying scintigraphy. During this test, you'll eat a meal or consume a small amount of food or liquid that contains a small, safe amount of a radioactive substance. Then, a special camera is used to track the movement of this substance through your digestive system. The test measures the rate at which your stomach empties its contents into the small intestine. Gastroparesis is diagnosed if there is a significant delay in gastric emptying. 5. Upper gastrointestinal endoscopy. In some cases, an upper endoscopy may be performed to evaluate the upper gastrointestinal tract, including the esophagus and stomach. This can help rule out other conditions that might be causing similar symptoms, such as ulcers or inflammation. 6. Electrogastrography, EGG. An EGG is a non-invasive test that measures the electrical activity of the stomach muscles. While it is not as commonly used as gastric emptying studies, it can provide additional information about stomach motility. 7. Wireless capsule motility study. This test involves swallowing a small, wireless capsule that transmits information about the motility of the digestive tract as it passes through. 7. It can help evaluate motility in the small intestine, which may be useful in diagnosing gastroparesis or other digestive disorders. How is gastroparesis treated? 1. Dietary modifications. Smaller, more frequent meals. Eating smaller meals throughout the day can help reduce the workload on the stomach. Soft or liquid diet. Consuming foods that are easier to digest, such as pureed or liquid foods, can be beneficial. Avoiding high fiber or high fat foods. These can be harder for the stomach to process and may worsen symptoms. 2. Medications. Prokinetic drugs. These medications help improve stomach motility and are often a first-line treatment. Examples include metoclopramide and domperidone. Antiemetics. Medications to control nausea and vomiting may also be prescribed. Pain management. If you have abdominal pain, your doctor may prescribe medications to alleviate discomfort. 3. Lifestyle changes. Dietary adjustments. Avoiding alcohol and carbonated beverages, and chewing food thoroughly can help reduce symptoms. Meal timing. Eating at a slower pace and allowing adequate time for digestion can be helpful. Stress management. Reducing stress and anxiety can have a positive impact on digestive function. 4. Nutritional support. Nutritional supplements. In cases of malnutrition or nutritional deficiencies, supplements may be necessary to provide essential nutrients. Enteral nutrition. In severe cases, when oral intake is insufficient, tube feeding may be required to ensure adequate nutrition. 5. Gastric electrical stimulation. Gastric electrical stimulation, GES, is a treatment option where a device is implanted in the stomach to help regulate gastric motility. It may be considered for individuals who do not respond to other treatments. 6. Surgery. In very severe cases that do not respond to other treatments, surgical interventions may be considered. These can include gastric bypass or subtotal gastrectomy. However, surgery is typically considered a last resort due to its risks and potential complications. 7. Management of underlying conditions. If gastroparesis is secondary to an underlying condition, such as diabetes, managing that condition effectively can help improve symptoms. What supplements help gastroparesis? 1. Multivitamins. A daily multivitamin supplement can help provide essential vitamins and minerals that may be lacking in your diet due to reduced food intake and impaired digestion. 1. Look for a multivitamin designed for individuals with digestive issues. 2. Vitamin B12. Gastroparesis can lead to a deficiency in vitamin B12, as it is primarily absorbed in the stomach. 2. Vitamin B12 supplements can help maintain nerve function and prevent anemia. 3. Iron. An iron supplement may be necessary if you have iron deficiency anemia, which can occur due to poor absorption of nutrients. 4. Calcium and vitamin D. If your dietary intake of calcium and vitamin D is limited, supplements may be needed to support bone health. 5. Electrolytes. In cases of frequent vomiting, diarrhea, or dehydration, supplements like potassium and magnesium may be needed to maintain electrolyte balance. 6. Digestive enzymes. Some individuals with gastroparesis may benefit from digestive enzyme supplements, such as pancrelipase, to assist in the breakdown of fats, proteins, and carbohydrates. 7. Fiber supplements. Soluble fiber supplements, such as psyllium husk, can be easier to tolerate than insoluble fiber and may help with bowel regularity. 8. Probiotics. Probiotic supplements can help support gut health and digestion by promoting a balanced gut microbiome. 9. Omega-3 fatty acids. Omega-3 supplements, such as fish oil, can provide essential fatty acids that may be lacking in the diet. If you want to live your best healthy life, then check out our special links below in the description section. To see more of our videos, research links, and more informative links, check out the description section below. Disclaimer: always check with your doctor before trying anything, especially if you are on medication. This information is just to be used as general knowledge and not medical advice. Thanks for watching our video. Please hit the like button, subscribe to our channel, and turn on the notification button so you don't miss a video. Also, tell us your results from using niacin.